For this lecture, we will discuss imaging artifacts for digital radiography. Much of this knowledge is practical to the clinical setting because artifacts can be avoided by a competent technologist. There are three things to keep in mind when watching this lesson. Number one, where the artifact is. Number two, how to avoid artifacts. And number three, what is the nature of the artifact. Before discussing the different types of artifacts, let us define what an artifact is in our own words. For myself, I define an artifact as anything which doesn't belong or interferes with the diagnostic quality of an image and prevents the radiologist from giving a reading. Now let's look at the definition provided by a textbook. It is any false visual feature on a medical image that simulates tissue or obscures tissue. Artifacts interfere with diagnosis and must be avoided. Now take all of those main points from my definition and the book definition and create your own. Now that we know what an artifact is, there are three types of artifacts found in film and digital radiography. In film, there is processing, exposure, handling, and storage. Now in digital radiography, there is image receptor, software, and object. This is due to the change in equipment and the image acquisition process. Our focus will be on digital artifacts because that is the most relevant to the field currently. The most common type of digital imaging artifacts is due to the image receptor. This applies to both CR cassettes and TR flat panels. Common causes are dust, dirt, damage to the imaging plate or flat panel, and pixel error. When I say pixel error, these include dead pixels or less responsive pixels that was an issue in the manufacturing process of the flat panel itself. The best way to avoid image receptor artifacts is to follow a quality control plan that keeps track of the condition of the cassettes. A lot of this is documented on a regular basis by the QC tech. When handling the image receptors, do not drop or use it in a careless fashion. Lastly, the imaging plate in the image receptor needs to be taken out and cleaned of dust and dirt. Let's take a look at this x-ray of the knee. Look at the two parts circled in blue. Notice the abnormal white spots. This is unlikely due to the patient. It is probably dirt or dust on the imaging plate because it wasn't cleaned for a while. Software artifacts, the second type of digital artifacts, occur because of issues in the processing method that the computer follows. It prevents the computer from recognizing the image and adjusting it correctly for display. Causes of these include histogram errors, reader errors, and quantum model. These are prevented by software correction techniques, staying up to date with the software, and regular servicing. Now look at this image of the chest. Notice the white bar moving down the right side. This is an error that may have occurred with the reader. Earlier I mentioned a histogram error being a software artifact. This occurs because the software cannot recognize the difference between the bone and the prosthesis in this example. That is why the image is completely white. You cannot see the separation between the two. The computer recognizes it as only one. Software correction methods are techniques that compensate for errors such as pixel dropout. This occurs during pre-processing with the raw data prior to the post-processing for display. These techniques include flat fielding, which corrects for non-uniformity across an image by equalizing pixel response to the X-ray beam. Following that, there is interpolation, which is a mathematical process of assigning a value to a pixel based on adjacent pixels. And then there is extrapolation, which is a mathematical process of assigning a value to a pixel that is out of the range of adjacent pixels. The last type of artifact for this lesson is object artifact. These artifacts are the most straightforward and easiest to avoid. These are mainly caused by patient positioning, superimposition of anatomy, and patient items. These are best avoided by removing everything from the patient for the anatomy of interest, being observant, and not being careless. I am going to end this lesson with this image of object artifacts. I hope none of you have patients like this or become one. And that is all.